Okay, good morning, everyone. Thank you so much for joining today. Welcome to the CSU Health Network session, Care for Body and Mind. My name is Abby Tynan, and I'm with the Health Network. I'm the Associate Director of Communications, and CSU Health Network is every student's on-campus home for health and well-being at CSU. So today I'm going to be going over the services provided for you at CSU Health Network, as well as reviewing some of the new student requirements and recommendations. There is a fair amount to cover today. However, we will have time for questions at the end of the presentation. I encourage you to use the Q&A function within Zoom, and please feel free to type in your questions throughout the presentation, and then we will either answer them during the presentation or towards the end after the presentation is over. So please feel free to use that Q&A function as it is useful throughout this presentation. All of the information covered in this presentation is on our website, health.colostate.edu, and I'm going to be dropping in the chat some helpful links for you to reference throughout this presentation or really at any time during the semester. You will find information about the Health Network, information about the Student Health Insurance Plan, mental health and well-being resources, so all sorts of helpful links that are going into the chat right now. So I encourage you to go ahead and check those out. So we'll go ahead and get started here with the presentation. So we will begin chatting a little bit about CSU Health Network. So if there's one thing that you can take away with you from this presentation, it's that you have full access to our wide range of services, regardless of your health insurance plan. So most international students are enrolled in the International Student Health Insurance Plan, meaning that you will all have full access to all of our services. And we truly are here to support you. We have medical, counseling, and health education and prevention services all under one roof. And we also pride ourselves on integrated care for the whole student, meaning that we don't like to look at students as pieces and parts of themselves, but rather we know that physical health and mental health are so largely intertwined. So we really like to take that integrated approach. And unlike other colleges and universities across the country, our medical and counseling services are all under one roof to best serve you. We also know that health and well-being is a really critically important part of your experience and success as a student on your path to graduation. And so we truly feel like we have a ton of services to support you on that journey to graduation. And one of the questions that we get asked frequently is, do we have real doctors, or are these students practicing on students? And the answer is yes, we have real doctors. They are board certified providers that go through rigorous accreditation processes, and they really love working with the college student population. I'm sorry, I don't know what's going on with my presentation all of a sudden. Give me just one moment, I apologize. Okay, I'm going to reshare my screen and hopefully we are going to be good to go. I apologize for that issue here. Okay, I think we should be good and folks should be able to see this again. So just a little bit about who we are at CSU Health Network. So we provide medical, counseling, and health education and prevention services to all students. And so we do have a wide range of medical services to serve you. And so we have a variety of general and specialty medical services. So Within our general medical services, we have our primary care. So this is like if you just need to come see a doctor, maybe you don't feel well, or even just you need your annual checkup, you can come and see one of our doctors. And then we also have a lot of specialty services that really set us apart from other colleges and universities. So that includes our dental services. So we do have a dentist on site, and actually the International Student Health Insurance Plan provides dental coverage. So it really is a great benefit. We also have an eye doctor on site, so you can get your annual eye exam here. So we truly have tons of services to serve students. And so we do have doctors as well as other licensed medical staff. We have a pharmacy on our first floor. So say at any point you need to have a prescription and you need to get that picked up, you can do so at our pharmacy on the first floor. We also have x-rays and then a laboratory. So if you need to get your blood drawn for whatever reason, you can do that at our facility. We also have physical therapy services. So if for some reason, maybe you're injured or you're needing physical therapy treatment, we have a whole comprehensive physical therapy office on our first floor. We also have an immunizations and allergy shots. We provide all of those to students. And so I'll talk a little bit later about our immunizations requirement, but if you need your flu shot, for example, or maybe some of your required immunizations, you can receive those at CSU Health Network. We also provide specific women's care. So we do have an OBGYN who specializes in women's care. And so she is a really great resource to students. And then of course, if you ever just have health questions, or if you maybe need a referral to additional services, we can certainly provide that for you. Next is talking about a little bit about our counseling services. So we know that mental health is really important to students, and we're very proud of the culture of help seeking that has been embraced by CSU. So this is all the way from the president's office to faculty, staff, and students. And so a portion of your student fees, it's about $53 per student per semester, helps pay for a wide range of mental health support resources at CSU Health Network. This includes crisis services, groups and workshops, brief individual therapy. We can also help with substance use questions and help. And in addition, we can also connect you to other campus resources that may be beneficial to you. So if you're ever interested in accessing any of our counseling services or mental health support resources, you can come to counseling services, and our licensed professionals will work closely with you to determine the services that are the best fit for your needs, given your goals, your preferences, and then what's clinically appropriate. So this next slide really talks through, like, what does that look like to access counseling services at CSU Health Network? And so the first step is to come and see us. So counseling services is located on the third floor of the CSU Health and Medical Center. And we have what are called drop-in hours. So these are open hours where students can come in and meet with one of our counselors one-on-one. And during these drop-in hours, you will talk through what your areas of concern are, your goals, your history, your unique circumstances, your identities, your preferences. And that counselor will work with you to co-create a wellness plan, or kind of next steps that best fit your needs and preferences. So for some students, this could be brief individual counseling. For other students, it may be groups and workshops. We actually have one of the best groups and workshop programs among universities in the country. In addition, we have a variety of online 24/7 resources and tools, such as You at CSU, which I'll talk about later in this presentation, Silver Cloud Cognitive Behavioral Therapy, and then we also offer Nod, which is a way to kind of build your social connections and help you make friends while you're at CSU. And so we have a variety, again, of mental health support resources to help you throughout your college experience at CSU. So we just encourage you, if you're interested in utilizing them, to come in during those drop-in hours and speak with one of our on-call counselors. Next, we'll talk through health education and prevention services, otherwise known as HEPS. So we are very proud of all of our skill building programs and services that are offered in our health education and prevention services office. So that includes, we have information around stress reduction. We have support to quit smoking and vaping. We also offer classes on mindfulness meditation. We have resources for substance misuse prevention, including alcohol and other drugs. And we also have sexual health education. In addition, we have a bystander intervention group, a peer education group called CREWS, which stands for Creating Respect, Educating Wellness for and by Students. And CREWS does a lot of really great work around choice making and what it means to look out for your fellow RAMs and how to spot a student in distress or if they're in trouble. So if at any point you hear RAMs take care, RAMs take action, that actually comes directly from our peer education group, CREWS. So this building may look familiar to some of you if you have visited the CSU campus in Fort Collins. So this is the CSU Health and Medical Center. We are located on the corner of College and Prospect, which are two of our main roads in the city of Fort Collins. And so I do want to point out a couple things on the map here in terms of just talking about how can you physically get to our facility once you're in Fort Collins. So when we were building our facility a handful of years ago, we didn't want the cost of parking or availability of parking to be a barrier to students coming and accessing our services. So as long as you have an appointment at CSU Health Network or will be utilizing one of our services, you can park in our lot for free during the duration of your visit to CSU Health Network. And I believe we're one of the only free lots on campus. So it really is a great opportunity for you to be able to park at our facility if you have a car in Fort Collins and utilize our services. In addition, you will notice on that top left-hand corner of the map, it says Around the Horn stop. So Around the Horn is a campus busing system that has stops throughout campus, including a stop near the CSU Health and Medical Center. So depending upon where you are on campus, whether you are in a class or if you're at the rec center, whatever it may be, Around the Horn could be a really great option to reach our facility if you're not interested in walking, longboarding, or biking, or any other mode of transportation. And then the last thing I'll point out on this map is the MAX stop. So the MAX bus is a Fort Collins busing system that runs parallel to College Avenue, which, as I mentioned, is one of our main roads in Fort Collins. And CSU students can ride the MAX bus for free with their CSU ID. And not only does it take you to numerous locations in the Fort Collins community, there's also a stop about a couple hundred feet from our west entrance. So that's another really great option for students to access our facility. Now let's talk about why do we exist? Why are we here to serve students, right? So we exist to help you with your medical and mental health needs so that you can succeed not only in college, but in life after you graduate too. So CSU Health Network is here to help you get healthy, stay healthy, adjust to this new environment, right? Sometimes coming to college, especially maybe in a different country, is a really huge transition. And so we really want to help you succeed in that adjustment. And then of course, we can also help you solve problems. So just know that there are so many resources that we're able to help you with. Now I want to talk about when we are open and how you can utilize our services. So CSU Health Network is only open Monday through Friday, about 8 a.m. to 5 p.m. And then of course we have adjusted hours during holiday breaks or university holidays and closures, such as winter break and spring break and fall break. But for the most part, we are, open Monday through Friday, 8 a.m. to 5 p.m. Counseling does have a few evening options for their groups and workshops. So it's best to check our website for current hours of operation. But for the most part, that 8 a.m. to 5 p.m. is pretty standard. We also have phone helplines for phone calls at night and weekends for urgent problems when CSU Health Network is closed. And I'll be providing those numbers here shortly. What we really encourage is for you to not wait. If you feel like you are needing medical help or mental health support, we encourage you to come early when problems are just starting so we can really provide you the best treatment possible. So as I mentioned, there are a couple ways that you can access these services, right, that I talked about. So again, those medical services in particular, there are a couple different ways. So you can, one, call our facility with the number listed on screen. So that's 970-491-7121. And you can call and make an appointment, and that will work for both our medical services as well as any of our specialty medical services. You can call and make an appointment, or you can walk into our offices. So say you wake up one morning and you're really not feeling well, maybe you're injured, you're vomiting, whatever the situation may be, you can walk in and receive medical care day of. And then last, you can schedule an appointment online through the CSU Student Health Portal. And so that can be really convenient depending upon your preferences and when you're able to make appointments. So again, you can call to make an appointment online, or walk into our offices. And again, this is just for our medical services. If you remember our counseling services, you have to, that first initial visit must be a walk-in visit only. So this HOW side is for medical services only. So let's talk a little bit about after hours and emergency care. So a couple slides ago, as we discussed, CSU Health Network is only open Monday through Friday about 8 a.m. to 5 p.m. So of course, if you're ever not feeling well or you're needing support, we encourage you to come and see us if we're open, as we are on campus and we do offer all of those great medical and counseling services that I just talked about. But what happens when we're closed, right, and you're not feeling well? So as I have mentioned, we have 2 phone helplines that are going to be a great resource for you. So I encourage you to write these down. So we do offer a 24/7 nurse helpline. The reason why this helpline is so beneficial to students is because say you're not feeling well, CSU Health Network is closed, and you're really not sure if it's appropriate for you to go and see a doctor. You can call our nurse helpline and speak with one of our on-call nurses, tell them how you're feeling, talk about your symptoms, and then that nurse can help guide you whether it's appropriate to wait and seek care when CSU Health Network is open, or go ahead and seek care in the community. In addition to our 24/7 nurse helpline, we also have a mental health crisis intervention line that you can call at any time. So if you are ever experiencing a mental health crisis, we encourage you to call that number 970-491-7111. And then of course, there is a variety of local urgent care and emergency room facilities in the Fort Collins area, and those are listed on our website. So again, if CSU Health Network is ever closed and you're needing that after hours or emergency care information, there is a list of those facilities on our website. But of course, if there's ever a life-threatening emergency, right? So that's the key, life-threatening, we encourage you to call 911. There are 2 emergency rooms in the near campus in the Fort Collins area. That is the Poudre Valley Hospital. That's the one that's going to be closest to CSU. And then there's Banner Fort Collins Medical Center. So again, if there's ever a life-threatening emergency, we encourage you to call 911. And then how will you pay for these services, right? So we talked all about our medical services and we've talked about our mental health support resources with counseling, but how do you pay for those? So your health insurance will help pay for medical services received at CSU Health Network, as well as if you receive medical services in the community. And then what you owe really depends on your health insurance plan benefits. So again, a lot of you may be on the student health insurance plan, so you definitely have different benefits at CSU Health Network than maybe someone who is on a private insurance plan. But really what you owe depends on your health insurance plan benefits. And then of course, as I mentioned at the beginning of this presentation, by paying your student fees, your counseling fee in particular provides access to all of those mental health support resources that we talked about at no additional cost to you. So we do not bill health insurance for our mental health support resources. So I know that's a lot of information and it's still, at least in Colorado, it's early in the morning. So I just want to test your knowledge of this presentation with a little pop quiz. So I'm going to encourage you specifically to use the chat function for these answers. So we're going to use the chat function and not the Q&A function. So I'm going to ask these questions and then drop the answer in the chat and we'll see what comes up here. So question number 1. What services are provided at CSU Health Network? Is it A, medical services, B, counseling services, C, health education and prevention services, D, all of the above, or E, what? I just woke up. I'm seeing all sorts of stuff coming in. Perfect. Great. There are lots of good answers here. So for those of you who put in D, all of the above, you are correct. So CSU Health Network offers medical, counseling, and health education and prevention services to students. Question number 2, do you have to be really upset to see a counselor? A, yes. B, no. C, they said no, but I think you do. See here. Okay, I'm seeing lots of good answers flooding in the chat here. That's great. Perfect. So for those of you who answered B, that is correct. So the answer is no. You do not have to be really upset to see a counselor. So our counselors are here to help you with your problems, whether they are big or small. Now, question number 3. What are reasons to come to visit CSU Health Network Medical Services? A, a bad sore throat. B, headaches. C, sickness. D, questions about women's health. Or E, all of the above. Awesome. I'm seeing a lot of E's. That's perfect. So yes, the answer is E, all of the above. Whether you're not feeling well, if you have questions about your health, we encourage you to come and see us. So our medical services are located on the 2nd floor of the CSU Health and Medical Center. Okay, question number 4. Should you go to the hospital if you have a life-threatening illness? A, yes. B, no. All right, I'm seeing some answers pop in the chat here. Good. It looks like the majority of them are A, and that is correct. So the answer is yes. If you have a life-threatening illness or emergency, you should go to the hospital or call 911. Okay. Question number 5, who will we tell about your visit? A, your parents. B, your teachers. C, your friends. Or D, none of the above. Awesome. You all are very smart. I'm seeing a lot of correct answers here coming in the chat. If you said D, you are correct. So the answer is none of the above. So in the United States, we do not share anything about your visit with people unless you want us to. So the CSU Health Network is completely confidential. And again, we will not tell anyone about your visit to see us unless you want us to. Okay, thank you for everyone who participated in our little pop quiz. I appreciate the engagement. And at this point, we're going to be moving on to the new student checklist portion of the presentation. So all of the information in this presentation can be found on our website, health.colostate.edu/new student checklist. And I did drop this link into the chat. So if you scroll all the way back, you will notice again that list of helpful links, and this is one of them. So if you're interested in following along on our website at some point, I encourage you to click that link and follow along. Okay. So the first thing here that we're going to talk about is submitting immunization records. So Colorado law requires every student to submit proof of the measles, mumps, and rubella vaccinations, okay? So you have to submit 2 MMR vaccinations in order to be enrolled as a student at CSU. And then if any of you are living in student housing, such as the residence halls, for example, Colorado law also requires students to submit proof of the meningococcal vaccination given within the last 5 years. So that's kind of the key there. And then in addition, CSU is requiring all students to be up to date with their COVID-19 vaccination. So we are requiring you to have that primary dose, whether it's the 2 doses of Moderna or Pfizer or the 1 dose of the Johnson & Johnson vaccine. We are not requiring boosters for the spring semester. So you just have to have that primary dose. Students can submit their official immunization records online through the CSU Student Health Portal, so we do not accept any paper records. In addition, your immunization records must be in English. So if they are not in English, we encourage you to have them translated and then submit those translated records to our immunizations department here. And so these are due by the first day of classes, which is Tuesday, January 17th. And so again, you can scan your records or take a picture of them, whatever is easier, and then submit them online through our student health portal. And there are detailed instructions in our new student booklet, which there's a link to that in chat, as well as on our new student checklist webpage. And I'll show you here in a couple slides how to access our student health portal from our homepage of our website. Next is to complete health forms. So while these are not required, they are highly recommended. And there are two here. So these are the health history and tuberculosis screening forms. And so you can access these by logging into your health portal at portal.health.colostate.edu. And you can complete these forms online. They shouldn't take you very long. The tuberculosis assessment simply assesses your potential exposure to tuberculosis. So this is not a test where you're getting poked with a needle. It's just an online questionnaire. It shouldn't take you very long. And then next, your health history form really just provides us the complete background on your physical and mental health prior to you arriving at CSU. So this really just equips our medical providers and our counseling staff with the correct information on your health history to provide you the best care possible. And the due date for these forms, again, is the first day of classes, Tuesday, January 17th. So as I mentioned, I would quickly walk you through how to access the CSU Student Health Portal. So this is a screenshot of our website, which is health.colostate.edu. And as you can see at the bottom of the screen, there's a quick links panel. And that second button in the quick links panel says Student Health Portal. So you would click that button, and then it would take you to this webpage, which is portal.health.colostate.edu. And here you will log in with your e-name and password, the same that you use to log into RamWeb, for example. And once you log into the Student Health Portal, it will take you to this page here. So this is kind of your home page of the CSU Student Health Portal. So as long as you have yet to meet these requirements, you should always have that you have pending forms notification that is right kind of at the top of the screen there. But of course, you can always access your forms through that My Forms button on that navigation that you can see at the top. And then whenever you have your scanned copy of your immunization records ready, you can click that document upload button there and upload your documents directly to the CSU Student Health Portal. So at this point, I'm going to be showing you a quick video about an overview of the US healthcare system. So I'm going to have to stop sharing my screen here and going to another screen, and then we'll get going.
Abby, I'm not hearing any sound.
You're not hearing anything? Okay, hold on. It might be because I have my AirPods connected. One moment. Thanks for letting me know.
The U.S. healthcare system offers some of the best medical care in the world.
We're good.
It is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, you will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government, and healthcare can be very expensive in the U.S. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the U.S. system. So medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, coinsurance, excluded charges, or some combination of these items that will ensure that you pay something. Carefully review your insurance documentation so you understand how these payments work for your plan. When you get sick or injured, where do you seek care? Here's where it can get complicated. The medical system in the USA is made up of a mixture of many different types of providers. Large and small hospitals, emergency rooms, private doctor's offices, urgent care centers, walk-in clinics, specialists' offices, surgery centers, pharmacies, and our favorite, the on-campus clinic. As daunting as it may look, if you keep a few simple points in mind, seeking medical care does not need to be overly complicated. The main thing to do is, if at all possible, stay out of the emergency room. Emergency rooms in the U.S. are expensive and are designed for life-threatening or very severe illnesses and injuries. If you have the flu or a sprain or minor cut, you can go to an urgent care center, walk-in clinic, on-campus clinic, or doctor's office for a fraction of the cost of the emergency room. The best place to start, if at all possible, is your on-campus health center or clinic. These clinics are typically available at reduced cost or even free, are close and convenient, and even if you end up having to go somewhere else later, will save you money under most insurance plans.
Great. I apologize for the little snafu there with our technology, but we will resume. Okay. Great. So this video then brings me to talking about fulfilling the health insurance requirement. So all enrolled students, again, have full access to all of our services regardless of their insurance plan. And we are an in-network provider with most major insurance carriers, meaning that we can file claims with your insurance plan for services that are received at CSU Health Network. So the health insurance is required for all international students, and international students are automatically enrolled in the CSU Student Health Insurance Plan. You are billed for the cost of the student health insurance plan after you register for classes. However, if you have a private health insurance plan or a sponsored plan, whatever the situation may be, you are able to opt out, meaning that you are not enrolled in the student health insurance plan, by completing a waiver process. And there's information about that waiver process on our website. You are able to opt out of the student health insurance plan if you can show proof of acceptable private insurance coverage. So if you do have other insurance coverage, you can submit, again, that waiver request form and a copy of your current insurance policy to the CSU Health Network Student Health Insurance Office. So the deadline to do this is Wednesday, February 1st. So it is a couple weeks into the start of the semester. So you have some time to kind of figure this out. Some accepted waivers include most employer group health plans, approved sponsor plans, or even individual plans that meet healthcare reform law. However, there are some non-accepted waiver plans. So those include any short-term plans, such as international student plans, foreign plans, or individual plans that do not meet healthcare reform law. So just a little bit about the CSU Student Health Insurance Plan, which, as I mentioned, all international students are automatically enrolled unless you complete that waiver. So the CSU Student Health Insurance Plan, otherwise known as SHIP, pays for all costs for most medical services when you are seen at CSU Health Network. It also pays 60 to 80% of most medical costs at a hospital or medical clinic. We have a dental plan that's available to use at CSU Health Network and with certain community providers. And in addition, we provide 250 flex dollars. And so these are for non-covered services at CSU Health Network, such as vision care, for example. The health insurance itself, which again is separate from the flex dollars, does not pay. It is not vision insurance.
It will not pay for elective services. It will not pay for non-medically necessary services or any over-the-counter medication. And there is a link in those links that I provided at the beginning of the presentation that will take you specifically to the page regarding the International Student Health Insurance Plan, so you can learn more about it. Now moving on to completing online modules. So there are 2 required modules for CSU students. So these are alcohol EDU and sexual assault prevention. So alcohol EDU is required for all incoming students under the age of 23. And alcohol EDU provides personalized feedback that encourages students to consider their own drinking decisions and those of their peers. Sexual assault prevention is required for all CSU students regardless of age, and it educates students on issues associated with stalking, interpersonal violence, and sexual assault. And in addition, there is another optional module called the Canvas Financial Wellness module. So this is for students who are interested in really learning how to manage their money more efficiently. So some topics could include understanding student loan debt, using credit cards responsibly, sticking to a budget, and then planning for your financial future. So access to these programs begins on January 7th. So that's coming up here. So we are doing some updates to the platform, which is why this access has been delayed and the deadline has been pushed back. So if you've tried to access these programs and have had issues, it's because they're not open yet, but they will be open shortly. And you will have emails sent to your colostate.edu email address reminding you that these programs are open and available for you to take. And so the deadline to complete these programs for spring semester is Monday, February 24th. And so if you do not complete these required modules by that deadline, you will have a hold put on your student account and you will not be able to register for your next semester of classes until these modules have been completed. So please put a note in your phone or your planner or whatever works best for you and make sure that you complete these required modules by February 24th. Now I'd like to talk about You at CSU. So You at CSU is our online student success portal that connects students with personalized on-campus and online resources. So You at CSU provides confidential, customized feedback to help students meet their goals or address their concerns in 3 areas: succeed, thrive, and matter. And so you can set up your profile now through RamWeb and start exploring. It's really cool because you will notice a variety of content cards. Some of them may have Rams heads on them, meaning that those resources are specific to CSU. Whereas those that do not have a Rams head may be an online article or a video that you can read, say about stress management. So again, we encourage you to set up your You at CSU profile and start exploring before the semester begins. So I want to acknowledge that was a lot of information, and I really appreciate you bearing with me during my technical issues today. But I just want to remind you that CSU Health Network is here for you, and we are here to support you. We are your on-campus home for health and well-being, and we would love to support you on your journey and your path to graduation. So if you are interested in learning more, I encourage you to visit health.colostate.edu for more information, as well as utilize those helpful links that I dropped in the chat at the beginning of the presentation. So at this point, again, thank you. And I'm going to go to the Q&A here and answer questions that were submitted during the presentation. And if you have any additional questions, I encourage you to put them in the Q&A and I will get to them here shortly. So let's get started on answering these questions. Okay. Great. So the first question is, I am a sponsored student. How can I apply for the health insurance waiver? So I'm going to get you that link here, so that way you are able to apply for the waiver. So just a moment while I find that. Okay, so shortly, I'm going to be dropping an answer into the chat for those of you who are needing the health insurance waiver. Okay, so that should be helpful. Great. how can I transfer my immunization record, I believe from a previous university, to CSU? So I would encourage you to call the health center of your previous university and ask for a release of your medical records, specifically your immunization records. Typically, most healthcare providers can provide that information via email. And so then once you receive those records via email from your previous university, you can then upload that PDF document to the CSU Student Health Portal. So if you went to school somewhere else and they have your immunization records, I encourage that you call their health center and ask for a copy of those records. Okay, next question here. So the first one is if I see that there are no forms to fill out in my health portal, does that mean I've completed all the necessary requirements? So most likely, yes. So if you know that you have submitted your immunization records, so including that means your MMR vaccination as well as your COVID vaccination, and then if applicable, the meningococcal vaccine if you're living in the residence halls, we know that you're done with that. And then if you fill out the health history form, that's perfect. So as well as the tuberculosis screening requirement. So in theory, if you know that you've done those things and that you have no additional forms to fill out in the student health portal, yes, you should be good to go, meaning that you've met that requirement. The next question is, how can I access the sexual assault prevention course? So the sexual assault prevention course, as well as Alcohol EDU, can all be accessed through your RamWeb account. So again, those courses will be opened on January 7th, so in 2 days. And so you should begin to receive emails to your colostate.edu email address starting January 7th, alerting you that those programs are open. And then once they are open, then you can access them through your RamWeb account. Next is obtaining your health insurance card online enough. So I'm assuming that you may be talking about the student health insurance plan insurance card. And the only way to obtain the insurance card if you are on the student health insurance plan is to get it online. So they do not mail any copies. So if you are on the student health insurance plan, you can download a copy of your health insurance card online and they will not be mailed to you. And so as long as you have a printed version or you're able to show that health insurance card, that's really important. So we would encourage you, if you are on the student health insurance plan, to go online, find your card, download that, and then maybe print it and carry it in your wallet. Because if you were needing to access services in the community, you would need to be able to pull out a physical card to hand when you check in for your appointment. Okay. We have a couple questions regarding access to recording of this presentation. And so I'm sure international programs can provide that, but I know we are recording, so I'm sure that this session can be provided to folks. The next question is regarding vaccines that are accepted to meet the COVID requirement at CSU and in the United States. So I can't speak to if the COVAXIN vaccine is accepted. However, if there should be a list from the World Health Organization, so WHO, a list of approved vaccinations. And if COVAXIN is listed, then it would end up meeting the requirements for CSU. So if you have a COVID vaccination that you're unsure if it meets the requirements, I would recommend that you visit the World Health Organization website and for a list of those approved vaccinations. Okay. Okay, so this question here says that the meningococcal vaccination is required for students living in the residence halls, and that is true. This is that I believe you're saying that you're going to be living in the international house, and is it mandatory for students living in other housing as well? From my understanding of the requirement, it is only required for students living on campus in residence halls. It is not required for students who are living off campus in university housing. So in that situation, the meningococcal vaccination would not be required. There is information, it looks like this person still might be interested in submitting a meningococcal vaccine waiver. And so I will provide some information here about how to do that here in one moment. Okay. So I will provide this information in the chat too for anyone else who is interested in receiving a meningococcal vaccination waiver. You will have to call the CSU Health Network to request that this waiver form be added to your profile on the Student Health Portal. Okay. The next question is, if you have not received any or all of the immunizations, the required immunizations, do they come at an extra cost if you take them after you've arrived at the university? So it depends. So if you are on the student health insurance plan, and if you receive your vaccinations at CSU Health Network, specifically the MMR vaccination and the meningococcal vaccination, those are what we call a covered benefit, meaning that they do not cost you anything if you receive those at our facility. However, if you go to a community care provider, so someone that is not CSU Health Network, and you receive those vaccinations, they will cost money. So if you are needing to be vaccinated for those required vaccines, what I encourage you to do is call the CSU Health Network number. So again, I can type that in the chat here. So I encourage you to call this number and ask to make an appointment with our immunizations clinic, because you need the required vaccinations to be a student at CSU. And then again, if you have the student health insurance plan, there would be no additional cost to you. So I hope that answers your question. Okay. Okay, so this next question says, I have a full coverage scholarship and my sponsor has provided me a health insurance plan already. Is this different than the one that the university provides? So I'm actually not sure. I can't speak to that. I would encourage you to come and visit the CSU Health Network health insurance office. So that is located on the second floor in our business services suite. And I would encourage you to talk with them, as there are a lot of variations among plans, and I can't speak to whether the plan that your sponsor has provided is the same as the student health insurance plan. So I'm not exactly sure. It looks like Bronwyn with international programs may also be providing some follow-up information to the student who asked this question too.
Yeah, and I just want to clarify, if you're a sponsored student, there will be a sponsored student session, and that waiver will actually be taken care of through that process. So you should not have to do that on your own, but those questions will be answered by the person who will help you with the sponsored student stuff. So
thank you so much. The next question that we have is the MyAmeriBen insurance needed to be set up before arriving at CSU? So for those of you who are on the student health insurance plan, you may be getting emails from MyAmeriBen, and so those are associated. So MyAmeriBen is the company that helps CSU with the student health insurance plan. The student says, I'm unable to access MyAmeriBen insurance and there are issues with my address, which is delaying the setup. Can I set up MyAmeriBen after my US arrival? So the first thing that I would encourage you to do is, again, come and talk with our student health insurance plan office, because I can't exactly speak to that. I will say I don't think there is an issue setting up your MyAmeriBen account after you arrive in the United States, because you are still enrolled in the student health insurance plan, meaning that you still have access to those plan benefits. It's just that setting up the MyAmeriBen account gives you access to your health insurance card. So the only reason why you might want to consider setting it up before you arrive in the US is if for some reason you would need medical care before you're able to come and see us and talk with us about this issue. But I would encourage you to call our office, or here, I'll even, you can email your question to the email that I'm providing in the chat, in the Q&A. And they should be able to help you. Okay. This person says, do I need to redo the TB assessment? I'm assuming when you say redo, it's because you might have already been a student at CSU. If you have already been a student at CSU, say for undergrad, and then you're coming back for graduate school, you do not need to redo the TB assessment. However, if you have attended school somewhere else and did a TB assessment there, and then are now coming to CSU, you will need to do a new TB test at CSU if this is your first time at the university. So I hope that helps. Okay, next one. Yep. So this next question is, can we get the MMR vaccine from the health network to complete the immunizations requirement? The answer is yes, you can get the MMR vaccination at CSU Health Network. Our immunizations department is by appointment only. So you will need to call the CSU Health Network to make an appointment, or make an appointment online through the CSU Student Health Portal. In regards to if there's a cost for the MMR vaccine, if you have the student health insurance plan, there is not a cost associated with that vaccine. If you have a different health insurance plan, then there might be a cost, but it just depends on your insurance plan. But if you are enrolled in the student health insurance plan, there is no cost for you to receive the MMR vaccination at CSU Health Network. Great question. Okay, let me make sure I've gotten to everything. I saw that someone said that you have received a blood test for MMR. So that means that you're testing for your immunity for MMR, and it hasn't come back yet. Is it possible to get, I'm assuming, to get that test redone once you arrive in the United States? And the answer is yes, you could get that redone, but you'd probably be paying an additional cost for that. But that is certainly an option that you could have that done here. What I want to remind everyone on in this call, or maybe provide some reassurance, is that even though the first day of classes is the technical deadline to meet the health insurance requirement, if you need to wait a week or so because of, you're waiting to get the vaccination, or if something, everyone has their own unique situation, while you will get a hold put on your account for the next semester, whether you're going to be enrolling in summer or even fall, you will still have plenty of time to get that hold removed, even if you don't submit your vaccination record, say, until February. So I don't want to cause any panic. Just know that there is time. If for some reason you have an individual circumstance that's causing you to miss that deadline, there will still be time for you to submit your vaccination records and get that hold removed before registration even begins. Good question. Okay. I think I've answered every question. Oh, maybe there's one more in the Q&A. Okay. So the question is, that this individual has already received 2 COVID vaccinations in their home country, and they're wondering if they need to have a third vaccination once they reach the United States. You will need to figure out if the vaccination that you received for COVID is approved by the World Health Organization, meaning that it meets the requirements for being a student at CSU. If for some reason the vaccines that you've already received are not an approved vaccine, then you will have to receive additional COVID vaccinations when you get to CSU, or you can choose to waive out of that requirement. So I hope that helps, but I'm not sure what COVID vaccines you've already received. So it just kind of depends, but I would encourage anyone to check on the World Health Organization for a list of those approved COVID vaccination types. Okay, so it looks like this person is maybe an online student for the spring semester and is maybe going to be coming in person potentially. this summer. Online students do have different requirements. So there is not a vaccine requirement for online students. So these vaccine requirements are for students who are physically on campus. So if you are going to be arriving on campus at CSU, I would encourage you to then submit those records for the semester that you are in person. Okay, we have about 2 minutes left. So there's still some time to answer additional questions if anyone has any. I encourage you again to use the Q&A function, and I'm happy to try and answer them for you. All right. Doesn't look like there's any additional coming through. So I want to thank everyone so much again for your time. I hope that you found this session to be helpful and you were able to get some of your questions answered. If anything comes up between now and the start of the semester, I encourage you to give us a call at the number that is in the chat. So that's 970-491-7121, and speak to one of our CSU Health Network staff, and we'd be happy to try and answer your questions and help you. But in the meantime, just welcome to CSU. I hope you have such a great semester, and go Rams. And again, thank you for your time and your patience as we experience some technical difficulties today, but have a great semester. Go Rams. Thanks again. Have a good day.
Thanks, everyone. We'll share this recording after. So if you have any questions or need to go back, we will share that link sometime early next week. Have a great week.